So the second booster dose, the fourth overall shot of the messenger RNA Pfizer and Moderna shots, is really a pretty interesting topic right now. It is a little bit complex and a little bit different than some of the other recommendations. And so what the FDA and the CDC came out and said is that those 50 and older may get that fourth shot. And then they kind of gave some gradation of strength of recommendation. And so basically those that are at higher risk are a stronger recommendation to go ahead and get that fourth booster dose. And the reason why this is a little complex is that we're playing a little bit of a guessing game of when the next surge is going to be, because we've learned through the last several shots that the COVID vaccines really protect against severe disease pretty well, but there starts to be some breakdown in the older and higher risk groups after 3 to 6 months. And then for the younger age groups, they're still protected against severe disease, but maybe require the higher antibody levels. So we have seen a very clear and very steep drop in hospitalization rates over the last few weeks, from peaking above 200 back in February to now even down less than 20 now. So we're at levels where we were last summer, when we were at a pretty low level. And so that's great. Part of it's due to, all of the vaccination efforts and boosting efforts and getting people protected. And then the other part of it is just Omicron came through and just infected so many people so quickly that it burned itself out. Unfortunately, that caused a lot of hospitalizations and a lot of deaths, but we got through it and are coming back out the other side. There's a lot of discussions and a lot is up in the air right now, because the funding for a lot of these public health emergency things are starting to expire. Testing is probably the prime example. And so certainly if you have insurance, it should still be pretty well covered at this point. Without insurance, it does get to be a little bit more tricky. Probably the best option still is, at this point, is the home test kits. And so you can still get those free through the federal website and everything. And I think it's like 8 tests per family that you can still sign up for and get it. In addition to multiple places around our communities, you can still pick up some of those free tests. And now the free tests aren't perfect, but they're pretty good, and they're certainly better than not testing. Sometime here in April or May, we're going to be getting more data about the pediatric vaccines down to younger age groups. And we think that the FDA and the CDC will be looking at that data here later this spring. And so there may be some more announcements coming about being able to vaccinate even younger children. And so that'll be another important development to watch as we move forward here.